Hello everybody. Hi, I am Jewel and welcome. Welcome to my channel. First of all, I hope all of you are doing great, that your healths are steady, that your families are doing well, and that you can have everything you need right now in these spikes of COVID that are going around. For all of us that have been, that are CKD patients, and all of us that are immune deficient, we have been staying home and our houses have become our sanctuary. At least I do everything online. I do shopping online, grocery shopping online, and all those things that, that I don't have to go out for to keep myself safe as a transplant recipient. But for some of us, illness does take hold and we have to go to the hospital, no matter what. So this is a continuation from the first video I did about patients share their hospital experiences, during COVID-19. The first story I did was about Jim being a transplant recipient and going into the hospital, and how how the nurses and the doctors kept him safe. This story is going to deal with Mary's hospitalization. Okay, guys, let's get started. This video, this information is coming from the National Kidney Foundation, and this story was written by Jim Myers, kidney transplant recipient and NKF Kidney Advocacy Committee member, and Mary Backler, transplant recipient and Kidney Advocacy Committee regional captain. We're going to now talk about Mary's experience. So let's get started. It started with chills, shakes, total body aches, dry cough, and a fever of 103.8 degrees. I called my transplant coordinator first, and she referred me to my primary care doctor out of concern that I might have contracted COVID-19. Primary care referred me to telehealth, where I spoke with a physician's assistant who thought I should be seen in person at urgent care. They all thought I might have COVID-19, a frightening prospect. When I arrived at urgent care, staff were masked and gloved at the door. They asked medical questions about my symptoms and checked my temperature. The receptionist was glassed in with a small open area for her to talk, and she was also in PPE. Being immunocompromised and a transplant recipient, I did not feel comfortable sitting in the busy waiting room, so I asked if I could wait in my car until I could be seen. They checked with the nurse, and I was taken back to a clean clinic room. The nurse also told me that I was the first person in the room that day, and it had been thoroughly cleaned beforehand. When I was finally seen, the medical staff were in full PPE, including gowns, gloves, masks, and a face shield. I felt safe. The doctor ordered a COVID-19 test, checks, x-ray, lab work, and the doctor said that the test would be back in 12 hours and they would call me in the morning. When I did not get the call from urgent care, I checked with my chart online and saw the tests were negative. I was disappointed that I did not get a call for such an important result for me. After my urgent care appointment, my transplant coordinator followed up due to sepsis concerns to check my temperature. I felt a weight lift having my transplant team there when I needed them the most. I am recovering quickly, getting daily exercise with my husband and dog, talking to my friends and family via Zoom to keep me connected to the world and keep socially distanced from people I don't know. Lessons learned. We both greatly appreciated the help and professionalism from the medical teams we met. We also need to thank our families and friends who supported us during our illnesses and who have given us such warm welcomes home. Remember that as a kidney patient, we are at a greater risk of contacting COVID-19, particularly if one is a transplant recipient and immunosuppressed. Make sure that your team and you are using PPE when you meet. Try to wait in safe area where there are fewer people. This could be your car, a private room at the facility, or even outside on a nice day. Keep social distance, especially around medical facilities. Also, if you want to receive the results of any tests from them, such as COVID, you may have to get a commitment that they can contact you directly. As the country begins to go back out, we urge you to protect yourselves and your families. As it's possible we can expect a new peak this year, which has already happened right now, guys. And the CDC continues to recommend that we self isolate and stay safe. As a part of the Kidney Advocacy Committee, we have had a chance to help and advise the organization on the continually evolving needs of kidney patients during this pandemic. This has helped shape the advice that they are giving to our public leadership, including in the latest letter to federal policymakers and state governors and educational briefings to educate around the concerns of the kidney community as economies reopen. We hope this gives you that needed medical care the confidence to contact your local emergency room or healthcare team. They will take care of all the necessary steps to keep you safe. And of course, don't forget to review the great materials at NKF and continue to provide for us. And that's available on COVID-19 support page. Okay, guys, as you see, most of us hopefully will not have to go to the hospital during this time of COVID, but there are many of us that might have to. And so the best advice that the National Kidney Foundation has given all of us, of course, is to always contact your team, your dialysis team, your transplant team, so they can be the forefront of you going into the hospital, making sure that you're safe and have everything you need. And of course, as you see through in this article, that doctors and nurses are prepared. When we go in, when we have appointments, to let them know what we're going through. They are prepared for us when we go into the hospital as transplant recipients with all the PPE and all the equipment that they need. The only thing that we have to do, of course, is stay masked. Talk to our teams and let them know what's going on, and they will be there for us. So, guys, if you found this information useful, please like, share, and subscribe. And as always, I am sending you so much love, so much affection, because I have went through this experience, and many of us have gone through this, and we want you to know what you need to do if you need to go through it too. We need you to know also that you are not alone in this journey. As you see through this article, there were so many people waiting and willing to help us through this experience to keep us safe from COVID-19, because a lot of us going into hospital don't have COVID-19, but many other things that we have to get through, and our teams will be there to keep us safe. Only thing we have to do, of course, is let them know. And as you see, like I said through this article, there's so many people out there, special medical teams that understand what we go through and are trying to keep us safe. And only thing we have to do is let them know. So, guys, if you found this article and this video useful, please like, share, and subscribe. And you need to know, of course, that there's so much love out there for all of us. People are so willing to help us, when we are in need. And it is a very great thing, guys. So take care of yourselves, and I will see all of you on the next video. Bye.